The midwifery staff are now going to look after the placenta. They will clean up the baby and they will bring you the baby for the first time to breastfeed that baby. Your focus is going to be just on that baby. The rest of the world just is not going to exist. When you start breastfeeding that baby, natural oxytocin is released, which makes the uterus contract back. Contraction of the uterus is accompanied by a discomfort, a little bit like menstrual pain, the cramping, which you put out of your mind because your focus is on that baby. But in some circumstances, that cramping sensation is one that is going to get stronger. As it gets stronger and it comes into your conscious zone, you're going to tighten up. When you tighten up, the flow is reduced to the baby has to suck harder, and that only increases your discomfort. In order to overcome that difficulty, we have got in our kit the means to overcome that difficulty. Inside the kit there is a sheet which supplies you with all the instructions dealing with the additional uses with which you can use the system. You have got extra wipes, and it tells you for afterbirth pain, take out one of the spare wipes, wipe an area on each side of the pubic bone just below the belly button on either side. When you do that, take out the electrodes which are in your kit. Apply them on each side where you have wiped. Now, disconnect your back electrodes and connect them up in the front into the sockets of these small electrodes. Turn on the stimulator again without pushing the button until you feel a strong sensation. You don't push the button because the booster button, is only for contraction pains. Turn on slowly to the center, count to 3, then bring it up a little more until you feel strong and comfortable sensation tingling from the stimulator. That tingling sensation will mask the contraction of the uterus. That distraction signal will lower the discomfort, thereby stopping you from feeling uncomfortable, stopping you from tensing up, and the flow will be natural without you having to put up with pain. Once you have finished feeding the baby, then you will have used up all the prolactin. The baby will go into its cot and you will want to do only one thing, and that's to have a good sleep. When you lie down to have a good sleep, you will find that your uterus is very tense and you can't find a comfortable spot for your legs. You will try desperately to go to sleep, but you won't be able to do it comfortably. That is the time when the instruction sheet will again come to mind, and item 3 on that list tells you to reconnect the back electrodes that you have connected. Turn up the stimulator without pushing the button because it's not contraction pain. Turn it up to a strong, comfortable sensation that will relax the muscle. It will build up the endorphins in your blood supply again, and above all, it will literally rock you to sleep. You will go to a second stage of sleep, which is much more refreshing, so that when you wake up, you're ready to face the little bit of work that is waiting for you.